Our first witness is Mr. Brian Blaze. Mr. Blaze is the president of Paragon Health Institute. He was a special assistant to the president for economic policy at the White House's National Economic Council from 2017 to 2019, where he coordinated the development and execution of numerous health policies and advised the president, NEC director, and senior officials. After leaving the White House, Mr. Blaze founded Blaze Policy Strategies and served as the CEO. Mr. Blaze.
Chairman Johnson, Ranking Member Merkley, members of the committee, thank you for the opportunity to testify. Medicaid is an important welfare program, but too often it fails the truly vulnerable: children, pregnant women, seniors, and people with disabilities. The federal-state Medicaid partnership is broken. Over the past dozen years, states have shifted hundreds of billions of dollars of Medicaid costs to the federal government. Washington now pays more than 70% of Medicaid spending, up from the historic 60%. I will focus my remarks on two major problems: the Affordable Care Act's expansion of Medicaid to able-bodied working-age adults, and the legalized money laundering apparatus that results in massive corporate welfare through Medicaid. The ACA created a powerful financial incentive for states to prioritize expansion enrollees over traditional enrollees. On average, when a state spends $1 of its own money on a traditional Medicaid enrollee, the federal government contributes $1.33. But for $1 of state spending on an expansion enrollee, the federal government contributes $9. Thus, Washington pays states 7 times more for each state dollar on expansion adults than for people Medicaid was created to serve. Multiple studies show that Medicaid expansion has made it harder for traditional enrollees to obtain physician appointments. It's increased wait times and forced more patients to rely on emergency rooms for routine care. Medicaid should prioritize the most vulnerable. Instead, its financing formula discriminates against them. The same misguided incentives explain the surge in improper Medicaid enrollment. Yesterday, Paragon released a study by Liam Seago estimating that nearly half of the 20 million Medicaid expansion enrollees were likely ineligible in 2024. This imposed roughly $33 billion in improper federal costs, with a major cost shift from states to the federal government. A few states like California and New York have exceptionally high improper enrollment, but the problem exists in virtually every expansion state. Congress should end the discrimination against the most vulnerable and equalize federal reimbursement rates for all enrollees within each state. President Obama proposed equalizing reimbursement rates after the ACA became law. A second major problem is Medicaid money laundering. The clearest example is provider taxes. Former Oregon State Representative Mitch Greenlick called these, quote, dream taxes for states. Quote, we collect the tax from the hospital, we put it up as a match for federal money, and then we give it back to the hospitals. To be clear, this is not a tax. It is legalized money laundering mechanism for shifting costs from states to Washington while generating windfalls for politically powerful providers. In 2011, then Vice President Joe Biden called provider taxes a, quote, scam, and said they should be eliminated. Senator Durbin has called them a charade. The Simpson-Bowles Commission, set up by President Obama, recommended ending them. President Obama proposed limiting provider taxes, and the One Big Beautiful Bill basically adopted his proposal. Broken Medicaid incentives have led to a new form of corporate welfare: state-directed payments. Under the Biden administration, CMS allowed Medicaid insurers to pay hospitals up to average commercial rates, or more than 2.5 times Medicare rates. Medicaid should not pay hospitals more than Medicare. Such excessive Medicaid payments distort the program's purpose and threaten seniors' access to care. In the One Big Beautiful Bill, Congress appropriately limited Medicaid payments through insurers to Medicare rates. Most Medicaid spending now runs through health insurance companies, generating enormous revenues for them. Yet there is remarkably little evidence that Medicaid managed care has improved access, health outcomes, or reduced costs. Increasingly, Medicaid managed care functions as a financing intermediary for corporate welfare. Medicaid's perverse incentives have also created a lucrative consulting industry devoted to helping states maximize federal reimbursement by gaming Medicaid's complicated financing rules. This does not improve patient care. Medicaid is an essential program, but Congress must improve the core incentives. Reward states for serving the most vulnerable, not for maximizing federal reimbursement. End the financial discrimination against the most vulnerable. Eliminate the Medicaid money laundering schemes and root out corporate welfare. Those reforms will help return the balance to the federal-state Medicaid partnership and improve Medicaid for America's most vulnerable citizens.
Thank you, Mr. Blaze.